overcrowded hospitals, patients lying in common beds to field hospitals. Exhausted health workers, doctors decide who will live and who will have to leave. Italy, why this happened. An article published in the journal Science published the reason for the serious loss of Italy. One elderly population. 23% of the Italian population is over 65 years old, and young people in Italy are particularly fond of interacting with the elderly in the family. The researchers noted that Italian children often live with their parents and grandparents in rural areas but work in big cities like Milan. Data on the composition of Italian households also recorded the same situation. The constant movement of young people between major cities and their home countries could be the root of silent infection of COVID-19 in Italy. Young people often work in social contact, attend mass gatherings, and unknowingly get infected and take them home. When they do not show symptoms, they are unaware that they are infecting their elderly family members who are vulnerable to COVID-19's attack because of weak immune system and other background diseases. The researchers said complete demographic information helped the government better confront COVID-19. The research emphasizes, one of the points we try to point out is that it is not enough to isolate the aging population, which is the object being identified as the most vulnerable, but isolate the whole society. However, an aging population does not mean it will be defeated by COVID-19. In Japan, where 28% of the population is over 65 years old, only 2,118 cases have been recorded to date. COVID-19, which had 57 deaths compared with Italy, had 105,792 cases and recorded 12,428 deaths. Japan quickly increased testing in the early days when the new outbreak broke out and issued a control order. Go to test slowly. Another important cause is the speed of COVID-19 testing in Italy. There are many people infected with the virus who do not show symptoms or only have mild symptoms that have not been tested for COVID-19 in time in Italy, making them unknowingly a source of infection. Experts warn that this could also cause the numbers published in Italy to reflect only the surface of the translation. 3. Smoking tobacco is also a factor that can make Italy most seriously affected in the COVID-19 pandemic. COVID-19 is a disease related to the respiratory system. Smoking can affect lung function and the immune system, causing smokers to experience severe symptoms such as respiratory failure when infected with COVID-19. 4. Close contact. Another cause is local tradition. To date, limited direct contact is thought to be an effective way to prevent COVID-19, but before the outbreak in Italy, people often greeted each other by kissing their cheeks, which could cause the virus to corona spreads faster. However, the situation in Italy can be a lesson for many countries against the COVID-19 pandemic. 1. Find out where there's an aging population and try to forecast places at risk of the most serious impact to track. 2. Encourage people to inquire about the health of their loved ones over the phone. Avoid direct visits. 3. Enhancing COVID-19 testing for people. 4. Encourage people to quit smoking and limit direct contact to prevent the spread of COVID-19.